Millions of Americans, the way to get relief from back and neck pain is to visit a chiropractor. No surgery, no needles, and no drugs. But it doesn't mean there's no risk. As David Wade shows us, some patients claim a visit to their chiropractor nearly killed them.
Britt Harva hasn't eaten a meal in 15 years. She survives on nutritional drinks poured directly into her stomach through a feeding tube.
If I try to swallow, it goes into my lungs. I aspirate.
How did a seemingly healthy woman lose her ability to swallow? She says she suffered a stroke during a visit to her chiropractor.
And I slumped over to the left, and he helped me straighten out, and I couldn't really focus. I couldn't talk.
The chiropractor had just finished adjusting her neck.
I felt very good. Like the ocean sound in my head, rushing noise. Terrified.
Doctors would later discover that an artery in her neck had been crushed, causing a stroke.
I've got a 7-inch scar from the back of my head.
Janet Levy had emergency brain surgery after a similar experience with her chiropractor.
After that, I was paralyzed on one side for months.
Chiropractors say the risk of an injury from a neck adjustment is so small that you actually have a better chance of being hit by lightning.
The risk of someone taking an Advil or Tylenol, okay, is far greater, or aspirin, is far greater than any adjustment ever performed.
Dr. Scott Dara is a director of the Mass Association of Chiropractors. He believes neck adjustments are safe. He says when a patient does have a stroke, the patient may have had a pre-existing condition, or they could have injured their neck before going to a chiropractor.
So you could have a cerebrovascular accident on Route 1 trying to look for oncoming traffic.
Dr. Lee Schwam is a stroke specialist at Mass General Hospital. He agrees it is rare, but says it does happen.
So I personally have seen many patients who had an episode of treatment of their neck with spinal manipulation and who a day or two later had the sudden onset of stroke-like symptoms.
Britt and Janet both say they were never told of the risk.
This did not need to happen. I was perfectly healthy, 26 years old.
Britt founded an organization that is now using billboards on the Mass Pike to raise awareness. Janet is working to pass a law in her home state of Connecticut requiring chiropractors to tell patients about the risk of a stroke.
We tell patients our risk too.
Dr. Darrow says he does outline the risk using a form like this one. But like Connecticut, it's not mandated by law in Massachusetts.
It doesn't matter if it is very rare. It only happens to 1 or 2 people. What's wrong with telling people it can happen?
Britt says knowing the risks and the signs of stroke could mean the difference between life and death. David Wade, WBZ News.